Hey guys, this is Dr. Cameron Dennis, the physical therapist with Back on Track Therapy and Wellness. And today I'm getting on and doing a video about pain that is between your shoulder blades. Okay, so you have your shoulder blades, they sit like that on your rib cage. Okay, and their job is to move up and down like this to allow for better shoulder motion. Okay, so better arm motion, up and down like this. Okay, people that sit at a desk during the day for work oftentimes have a posture similar to this. Okay, you'll see them kind of rounding like this. Okay, now there's nothing inherently wrong with having, with sitting in that position. The problem comes when that's the only position that you're maintaining throughout the day. Okay, you're not getting out and exercising, and even if you are, you're not using your shoulders in the way that you need to reduce or to add variability into your movement, which, as we know, can help with pain. So no matter what people tell you, just because you have poor posture doesn't mean that you necessarily have to have pain. Okay, it's as long as you're getting that variability and you're getting that chest opened up and improving the mobility of your shoulders, and you have good mobility there and in the neck, chances are you won't have pain. So don't let anybody lecture you about posture, okay? It's not always correlated to having pain. But the important thing is that we know that sometimes if you're not getting that exercise, you're getting tight through the chest here and the pecs, and you're getting a little bit weak here in the back, which happens if your arms are always in this position here. So if you're at a computer desk and you have that position, what can happen is the front gets tight, the back muscles here and the muscles between the shoulder blades get weak, okay? What can also happen is if you're sitting at a desk, depending on the position of your chair, depending on the position of the monitor, a lot of people shrug their shoulders up, so you get lots of tightness here from the upper trap muscles into the neck. That can even lead to headaches, migraines, neck pain, and pain between the shoulder blades. So what can we do to potentially try to self-treat this? Well, one, you can start, you can get massage. I guess it's not really self-treatment, but what you can do is you can either use a tennis ball on the spots that are painful up against a wall, and I can do a video showing you that. But that's really just going to be more of a temporary fix. In order to fix, potentially fix the problem and the pain between the shoulder blades, what you're going to do is try and stretch out the pecs. So how do you do this? Okay, one way that you can do it is if you have a doorway in your house, okay, you put your hands here and you're going to stretch out like this. Okay, from the side it looks like this. Okay, so my chest is up, my head is up, I'm stretching here. Okay, so you'll have your hands in this position. You'll hold that for about a minute or so. You can also do it in this position here. Okay, you can also do it up higher. Okay, so there are different parts of the pecs that's stretching in each position. Basically, you just want to make sure that the humerus here is going back and you're getting that stretch across the front of the chest. Okay, so like I said, here, here, and here. Okay, on the doorway. So that's one way that we know how to open up the chest. The next thing that you can start with, and it's hard to see me here, the next thing that we can start with is by squeezing those shoulder blades back. Okay, I'll show it from this angle. Squeezing the shoulder blades back as if someone put a $100 bill between your shoulder blades and you're trying to pinch it and hold it there. Okay, there are little muscles back there that retract the shoulder blades. We're trying to activate those muscles. Okay, opening up the chest, showing our body that we can move through that range of motion pain-free. Okay, the last thing I want you to try is an upper trap stretch. So you'll put your hand behind your back, you'll turn your head the opposite direction, and you'll bring the neck and the head down. Okay, you should feel that right in here. Okay, same thing as all the other stretches I've talked about. You're going to do that for about a minute. You'll do that on both sides. Even if it's just the one side that's hurting, I want you to do it on both sides, okay? So these are some things that you can try to get rid of that neck pain or pain between the shoulder blades. So that's really just where to start. As you progress, you'll want to get into more challenging exercises for the thoracic spine and for the trunk, and as well as the muscles, the trapezius muscles, and the upper trapezius and the middle and lower traps as well. So like rows, for example, a rowing machine, or you can start off using a TheraBand in a doorway. I can demonstrate those, but basically try those exercises that I did demonstrate. If you would like more help, if those seem like they helped a little bit, but maybe didn't get rid of the pain completely, you probably just need those exercises progressed. I would suggest going to see a physical therapist. If you continue to have pain in any form, following those exercises. If you live nearby to Wapak or Wapakoneta, Ohio, I would suggest that you give me a call. Hopefully I'd be able to help you out to get a more specific idea about your particular body, your habits, and see if there's anything that I can do to kind of guide you back into pain-free living. So because everybody's different, these exercises are not the end of the road, it's just something to try. It's the beginning of the path. If they help, great. If they don't, you may need an assessment to figure out exactly what is causing the pain and how we can fix it, okay? You don't necessarily need neck surgery. You don't need back surgery, okay? There are certainly people who may need those things, but for the vast majority of people, physical therapy is going to be the first and best option, okay? So this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And please let me know if you found this video helpful by either liking, commenting, or sharing. And I appreciate you watching. Thank you.